We're now joined by two health professionals from PAM Health Rehabilitation Hospital of Victoria. We are welcoming Ashley and Scarlett. Welcome.
Good morning.
Good morning. It's so great to see y'all. Let me tell our viewers a little bit about y'all. Ashley Rodriguez, you're an occupational therapist.
That's right.
And Miss Scarlett Clutter, you are a physical therapist assistant.
You got it. Yes.
And we're going to start our conversation off with arthritis and joint pain, especially during this cold weather. What are some strategies our viewers can use?
Yes, ma'am. So for a long time, people have said that they hurt a little bit more in the winter, especially our elderly patients that have both rheumatoid arthritis and osteoarthritis, and that is true. There have been many studies that show that during the winter times with this lower temperature, that pain is more pronounced in those arthritis joints. So some of the ways that the patients can kind of fight that off is trying to stay warm. They can stay inside, find a nice place to warm up, like on the couch or with a heated blanket, or using hot pads on some of their joints even, and making sure that they're layering up when they go outside.
Is glucosamine also helpful? I know I had arthritis for a little bit, and my mom would give me the liquid glucosamine. I think it's like a vitamin.
It can be. The other vitamin that is important too with arthritis pain is vitamin D.
Oh.
And so during the winter time, we don't have as much exposure to sun, so we don't have as much vitamin D in our system. So talking to your doctor about also supplementing with that to help with arthritis pain is good too.
Can a patient come to PAM Health Rehabilitation Center if their arthritis and joint pain becomes persistent?
They can. Movement is the biggest help for pain, because we have this fluid in our joints. It's called synovial fluid, and so when we are moving more, then that fluid is being replaced constantly and replenished, and so they need that motion in the joints to help them alleviate some of that pain. But they don't always need exactly therapy. It'd be great for them to come see us, but you can do other things like going to the mall where it's warm and walking, finding a gym where you can do like a low impact exercise, like the new step or a bike. Getting in the pool, those warm therapy pools are really good.
Pool is great.
Sitting in a sauna to kind of get some more of that warmth as well on your body is good, but you always want to make sure that you're doing it what's safe for you. So if you have other issues like CHF, or if you have any heart issues, make sure you clear it with your doctor before you do any of those things, just to make sure that they're safe for you.
And what about yoga?
Yes, yoga and Tai Chi are great.
Oh, Tai Chi too?
Yes, yes, because they're very low impact, but very calming and good for all of the body.
Well, I know many of our viewers suffer from arthritis, and they are welcoming these tips. We're going to have more tips coming straight up. Just don't go, or rather, don't go anywhere. We'll be back with more from PAM Health. And we're back with two health professionals from PAM Health Rehabilitation Hospital of Victoria, and the topic is arthritis and joint pain, and especially in cold weather, since we're having some of those freezing temperatures in our area.
It's a good time to be talking about this, I'm sure.
Definitely. It's hard for any of us to get out of the home right now, and let alone with arthritis or joint pain. It can be quite painful.
Yes, ma'am, it sure can.
So kind of diving deeper into the topic, what is the difference between arthritis, like rheumatoid arthritis, and osteoporosis linked?
Osteoarthritis, yes.
Osteoarthritis,
yes. So there is a link between osteoporosis and the change in your bone density leading to osteoarthritis. They are not always hand in hand, but often they are. And so as we age and we start losing that bone density, we also lose some of our different cartilage and everything in our different joints as well. Most commonly we see it a lot in knees, but it can also be in your shoulders and your backs. A lot of people feel the RA more in their hands when they start out. And with osteoarthritis, it's important that you get ahead of it, that you start having a lifestyle of movement and continuing to move and do things, and continue that on even as it starts to progress a little bit, because you'll see more benefits from it as you continue moving.
So it's that daily cardio, that yoga, the swimming, bike riding, staying active, getting that heart beating faster at least once a day.
Just a little bit more than going from your recliner to your bed to your kitchen, trying to put a little bit more effort into moving a little bit more and staying outside of those safe zones, because often we can do our daily task easily. We can get up from the couch and we can get out of bed and we can bend down to pick things up. But if you're actually lifting your leg a little bit higher and doing some marching or moving in a different way, that's when it becomes difficult. So sometimes people will have it difficult to get in and out of the car because that's a little bit bigger of a motion. Getting in and out of the bathtub sometimes is a little bit bigger of a motion than that zone that we stay in when we walk. And so that's when they're going to really feel that pain.
Even going up and down a flight of stairs.
Yes.
I know that can be. I had arthritis for 6 months in college. It was so painful. And not just physically, but emotionally too. I had to use crutches on campus, and I just felt so ashamed. I couldn't explain why. And I knew I was not doing anything shameful. I was just in a lot of pain.
Yeah, definitely people with arthritis, whenever it comes to being a chronic condition, a lot of times it is really hard to get back to those daily activities, right? Because it hurts, right? But really, movement is the medicine, right, for osteoarthritis. And the more you move, the more, like Scarlett mentioned, the fluid in the joints is produced and regenerated so that it can continue to help those joints move more fluidly. And then getting back to those daily tasks that give us the dignity, give us the to get up and go, right? To be able to participate in our daily activities. It's a really important thing. So when we feel like we can't, it can really put folks in a lower mood. And then with the cold weather, not being able to get out as much, it can make depression and anxiety really exacerbate.
Definitely, that family support system is so important. I think I binged Heroes to make myself feel better.
Yes.
And I had to leave school too. It was really serious. But thankfully it was stress induced, so it went away. I was on a daily steroid. But it just gave me a whole new level of respect for the elderly. And speaking of being older, osteoarthritis, is that something that only comes with age?
Well,
Typically?
Yeah, typically, I mean, definitely more wear and tear, but you'll see that folks that have done, that are athletes from a young age are probably going to have it earlier than the typical older adult, which is qualified for 65 and up.
And people like oil field jobs where they're very hard on their bodies for long periods of time in varying weather states.
Oh, wow.
They'll feel it earlier as well.
Because they're really carrying a lot of heavy equipment.
And they're in repetitive motions too.
And that heavy
because you're wearing
gear.
down those joints as well when you're doing repetitive motions like that.
Yeah, so definitely occupation-based and different sporting, and that's why even getting into it with cross-training with kids, not picking one sport really early on and letting them choose different sports and try different things, because if they're throwing a ball one way for 12 plus years and not working those other muscles and joints, it could really affect them in the long run.
Wow, it's so interesting. I'm glad that y'all made the time to be here to talk to us and give us this deeper insight on arthritis and joint pain. And y'all are going to continue to give us that insight, but we're going to switch topics. Right after this break, we're going to be talking about coping with the cold and being elderly, how the elderly can use some strategies to combat that cold pain. We'll be right back.